So hi, my name's Tom Baker. I'm a strategy director from BT and my primary focus is health, well-being, local government and future cities. So I'll be presenting here today on a couple of subjects. Firstly, BT's interest in connected health at the end of the day, and I'll also be speaking and be part of a panel session on the subject of the Internet of Things, and I'll be talking about the Internet of Things in the context of future cities, which can be quite a broad subject and encompass many different things, but I think the thing that really interests BT is the continued need to aggregate and to focus and to take a whole system view of things such that we can understand systems and places much better, because actually a lot of our built environment, a lot of our public spaces, the quality of our housing stock, all influences materially on people's health and well-being. So those linkages, I think, to us are very interesting, and that certainly will be the focus for the first session I'll be talking about on the Internet of Things. There's a lot that we think is different or has the potential to be different here in Bradford. So to give you a flavour of that, a bit of context, I was at a conference yesterday over in Liverpool, part of the International Festival of Business, on the subject of connected cities, which was being run in conjunction with the Wireless Broadband Alliance. And speaking at that event were quite a large congregation from many different cities, including New York, Bordeaux, Bilbao, Singapore, a number of African cities, also cities from a number of Arab states. And what was really interesting actually was understanding what those cities were doing. They were implementing and investing in infrastructure. They were looking at technologies to aggregate data. They were doing small-scale trials and pilots around the area of connected health. And I challenged a lot of those speakers at that event and said, well, actually, how are you driving sustainability within these programs? What's different? What has emerged through the provision of those infrastructures and those technologies? And actually a lot of those cities had a great deal of difficulty answering that question. Now what I think Bradford can do, and if it can do this, it can steal a march not just in the context of its position within the UK, but also its potential position globally, is that actually it needs to bring together infrastructures, it needs to bring together the right partnerships, and most importantly, it needs to bring together some of its challenges and its problems. Now, if it can link those challenges and problems to a community of innovators, SMEs in this building and across Bradford, and it's also got the desire to prototype, to be bold and to challenge, and to provide those innovators, those SMEs with a route to market, which is really, really important, then actually it can start to demonstrate that something that I don't think any city globally has really got to grips with. And that's almost a virtuous circle linking through societal challenge to civic innovation, to viable marketplaces such that this stuff can flourish. And that's what we hope to see here in Bradford. And I think the Internet of Things is a bit of a misnomer to a certain extent in many regards. I think that the interesting thing here about Bradford is they're focused on outcomes, they're focused on what matters to citizens, and that's eminently sensible when talking about anything in the context of health and social care. So move away from the technology piece, think about what's important, and as we look at the challenges that we've got in this country, maybe exemplified over the past few days, then we need to think about how we serve our ageing population. We need to think about some of the pressures on the NHS. We need to think about some of the pressures on our hospitals. Now, the field of connected health offers great hope, potentially, with respect to alleviating some of those pressures, allowing people to take more control of their own health and well-being, allowing people to stay independent longer within their own homes. Now, of course, that's a win-win situation. It's a win-win for the patient because they're at home with their loved ones in an environment where they feel safe and secure, but also it means that people necessarily don't need to go into hospital with such regularity. Now, if the Internet of Things, devices, monitoring, whatever it may be, applications help facilitate that, if they help us to be healthier, live longer, live more independently, then that's fantastic. And actually, if you quantify that, that marketplace is phenomenal, absolutely huge. So a really sort of noble thing to try and do and achieve, quite a significant marketplace out the back end of it. but absolutely dependent on the right partnerships to bring it into being. Well, I think the rationale for small businesses looking to set up in Bradford and looking to set up here in the Digital Exchange are several-fold, actually. Firstly, I mean, look around you, it's a wonderful space, it's bright, it's airy, there's some lovely exposed beams. Yeah, it's absolutely fantastic, state-of-the-art networks, all of those good things. But actually, these sorts of facilities exist in every city across the UK, so we shouldn't think that this building in itself is unique, because simply it isn't. What I think has the potential to be unique are the other networks. The networks that exist between the public sector, the private sector, large businesses like BT, small businesses, and actually what we've got the opportunity to grow here, if we work in partnership, across West Yorkshire, is a really sort of vibrant network. It's the ability for organisations to feed off each other, feed off the commissioning intent, which hopefully emerges across the public sector in the region, and also has the potential to tap into living labs, the ability to trial and test your products here in Bradford or wider across West Yorkshire, such that you can demonstrate the value of those, such that you can gain the credibility to think about selling those either to consumers, which will be increasingly important, or to public sector commissioners.